like, get happy because it is so depressing outside.
And now we're live. It is. Hello, Dr. Yen and everyone that all of our followers on our Facebook page. Today, I'm bringing Dr. Yen, and we're actually just talking about the weather. If any of you guys are in California, I'm not sure if you can see my window, but outside it's very, very, very orangey. Yes, and it's again.
It's just a depressing day. So I suggest everybody just bounce and be happy, be silly, find your favorite plush toy, do a little boogie, whatever gets you going, because I just want to crawl into bed.
Yes, I think a lot of people have said that they're feeling like crawling into bed. Orange is actually my favorite color, so that's why I put on a matching the skies outside. But first of all, I just want to thank you for joining, and everyone that's watching, you might have joined in and saw just earlier, Dr. Yen was with one of our PCAs, our patient care associates, who help some of you guys who are interested in birth control get through the process. They answer a lot of your questions. Hello, Judith. Hello, thank you for joining us. Ooh, looking good, Judith. So thank you for everyone who watched that. That's all in Spanish. So please share with any of your Spanish-speaking friends who want to learn more about birth control. Dr. Yen, she's really amazing and great at Spanish. She's trying. I'm not good at Spanish, so she's doing really well. And then, so let's get into today. All of the questions for today. So really quickly for everyone, just make sure that you sign up for free delivery of your birth control with Pandia Health. If you already have a birth control prescription, you can go ahead and just get the free delivery through our services. We take almost all insurances, so you should be covered, and we ship all throughout the US. If you need a new prescription, and we actually found out a lot of women do not have active prescriptions, we got you if you are in California, Florida, Texas, Arizona, and Wyoming. Wyoming, and hopefully more places by the end of the year. And so if you guys use the code TRENDING down below, if you guys use the code TRENDING down below, then you can get $5 off your online doctor's consult. So with that being said, let's get into some of the trending topics that a lot of people are asking about birth control. So question number one is, can you take Plan B on birth control?
Yeah, so if you're taking your birth control regularly, you don't need to take Plan B. However, if you take Plan B, how soon should you start your, let's say, holy crap, you got scared, you took the Plan B, and you're like, oh, I signed up for Pandia Health, and now I got my birth control. How soon can I start this birth control? You can start it immediately with Plan B and its generics. However, this is an opportunity to educate you all about emergency contraception. At Pandia Health, we are the only women-founded, women-led, but more importantly, the only doctor-led company an academic doctor. I'm a clinical associate professor at Stanford. And so the science shows that the prescription emergency contraception, ELA, is better at every time point, and specifically if you have a body mass index of 26 or greater. And I think that's roughly either 165 pounds, 175 pounds, and that 60% of those with uteri in the United States are a BMI of 26 or greater. So a greater than 50% chance that you have a BMI of 26 or greater. If your BMI is 26 or greater, Plan B and its generics is as good as, somebody told me this today, I always say water, but they're like as good as Tic Tac for preventing unplanned pregnancy. It's not good. So if you really want to prevent unplanned pregnancy, you want the prescription emergency contraception, ELA. And at Pandia Health, we always say with your birth control, in case you mess up, you forget, you run out, things happen, your friends need it, then let's write you a prescription for emergency contraception. And under the Affordable Care Act or Obamacare, most insurances will cover a prescription birth control, no copay, no deductible, aka free. So ELA works better and is free if you have insurance. If you don't have insurance, then it does cost a little bit more, but it also works better at every time point. The problem with Ella is if you do take it, it's an anti-progesterone. And so all the hormonal methods, the pill, the patch, the ring, the IUD with hormone, the shot, the implant, all have progesterone. And so if you're doing an anti-progesterone and you throw progesterone at it, then you just block the effort of the Ella. So if you do take Ella emergency contraception, the prescription emergency contraception, you have to wait 5 days before you throw on anything with progesterone, aka your pill, your patch, your ring, an implant, an IUD, or shot. Otherwise, it's not going to work. The Ella won't affect the birth control if you add on birth control, but it won't work for that one incident that you're trying to protect against.
Okay. And then a common question actually that we get asked a lot is, does Pandia Health offer EC? And what if I need it now? Like, can you give it to me now? Or what do you do people that need it now?
That is a great question. So if you need emergency contraception now, what you can do is sign up for our regular birth control service because you need regular birth control in the long term. Maybe that's why you had a contraceptive accident. And as part of it, as I said, we always say, do you want some emergency contraception with that? And you can be like, yes, and I need it now. And so we won't mail it to you because with emergency contraception, I tell my patients, if the condom pops at 3 a.m., I want that medicine in the person with the uterus who's not trying to get pregnant's mouth by 3:10. I don't want any cuddling, snuggling, wait until the morning after. And technically, it does work up to 5 days after, but it depends when your egg pops out. As soon as your egg pops out, game over. Probably not going to work. So if you think you need emergency contraception, I want to get it to you as soon as possible. So just quickly fill out our system, tell us you need it, and then tell us where your local pharmacy is, and we can send that prescription for Ella there. It will be covered if you have insurance. If not, then you pay cash. Or if you don't want to go with Ella, you know you have a body mass index less than 26, you're okay with a lower efficacy chance of getting and a higher probability of getting pregnant, you can go any pharmacy, anybody of any gender, of any age in the United States can go to a pharmacy and get Plan B or it's generic over the counter. And I would always ask for the generic because if you just say, I want Plan B, the pharmacy's like, $60, Plan B. But if you say Plan B generic, they're like, $20. You know, and even then shop around. Some of them will be 40, some of them will be 20. At Pandia Health, we're really about trying to make not much money off you, just enough to live. And so I believe we're charging $20. If you get a birth control pack, we just throw on emergency contraception for $20 for Plan B. For the Ella, unfortunately, it costs more. It's like $40. But again, $40 versus being a baby mama when you don't want to be a baby mama, I think worth it. And when we give it to you, we give it to you for advance. So we find the one with the farthest expiration date, ideally 2 years. So $40 investment for 2 years, peace of mind. Again, it's Plan B or the second plan. Your first plan should be a good everyday kind of birth control method, meaning one that covers you every day. It can be the pill, the patch, the ring, or because we'll always tell you what's best for your health, IUD with hormone, implant, or shot.
Yeah. And I think that's so important that you mentioned that, you know, if you're using maybe emergency contraceptive, it's also important to just use regular birth control. I actually know a couple of people, and I also have talked to and met people who say that they use just EC as their regular form of birth control. And so it's really crazy, one, because I'm sure it's not healthy for you to consistently be taking any type of EC consistently every time you have sex. And I don't know, maybe someone's having sex like every day. And so, and also the cost of it, right? Because it might be really expensive to just keep buying emergency contraceptives versus just getting your generic birth control pack.
Yes. So yes. Hey, Dr. Nim. So good to see you. Hey. Love you. We should get you on so you can get me some respite. But yes, I absolutely hear in communities who don't have access to physicians or somebody to prescribe birth control. But most people, luckily in California, do have insurance between Medicaid, between Family Pact, anybody under 200% of the federal poverty level in California. If you need insurance to cover birth control, go to familypack.org and the government will cover it and pay it. Don't use emergency contraception as your primary method of birth control unless you have no other option. But as we mentioned, $20 once a year to use our passionate birth control expert doctors such as Dr. Niem, as well as us, myself, and look at all of our doctors. We're proud. We list our names. So just for $20 once a year, we can write you a prescription. If you have insurance, it's no copay, no deductible for the medicine, aka free. Versus Plan B, if you buy it at the wrong place, $60, $40, Plan B generic, $40 every single time, and also just jarring to your system. So the way Plan B and its generics works is like progesterone, and then the progesterone goes away, and the body's like, oh, no progesterone, time to bleed. And you don't want to do that more than once a month or even once a month. And it works 75 to 95% of the time, depending where you are in your cycle. And so if you use a more stable method, the pill, the patch, the ring, and certainly the IUD, the implant, or the injection, those three are like 99.99999% effective. And then the pill, the patch, the ring, if you're good at taking it or sticking with it, 98% effective versus 75% effective. So for those of us, who are Asian, the Asian F is like a B or whatever. There's a difference between 98% and 75%. And that's a 1 in 4 chance of getting pregnant versus 2 out of 100 chance of getting pregnant. So use a long-term, do not use emergency contraception as your primary method. And in California, Florida, Texas, Arizona, and Wyoming, we're here for you. In the other states, we have friends that we could refer you to.
Awesome. Thank you, Dr. Yen. So next question, and thank you, Dr. Niem, for sharing us on your Facebook channel. If any of you guys are new to us, make sure you follow. But next question is, does birth control cause hot flashes? Now, for me, I kind of understand what hot flashes are. Is that when you get like really sweaty and feel really hot and perspire?
Yes.
And I usually associate that with a little older.
Yes.
So like, have I experienced hot flashes? I'm not even sure. You know, that's trending right now.
So I think what people have heard is like when you're on birth control, it basically tells your body you're pregnant. And so some people see this as a chemical castration, but it's not. So you can actually do a chemical castration with a different drug. It's an injection and it's called GnRH. And with GnRH, you'll get hot flashes. But birth control, and you could use GnRH maybe as a birth control because it turns off everything, but that is not what the birth control pill, patch, or ring, or the IUD or implant or shot are doing. It's telling your body from the birth control side that you're pregnant. And so it shouldn't cause hot flashes. And if you're getting hot flashes, then maybe you need to see your doctor and get your thyroid checked. Because if you have high thyroid hormone, then your metabolism is up and you get really, really hot, really, really easy. And then the other side is if you're on the birth control pill, patch, or ring, and you're old, like 45 to 50, 55, and you're perimenopausal or almost menopausal, it's not the birth control pill that's causing these hot flashes. It's menopause that's causing these hot flashes. And certainly some women have premature menopause, but the incidence is so low, like 1 in 1,000 or 1 in 10,000. So if you're under 45, you really shouldn't be having hot flashes. And if you are, it's probably not related to the birth control pill, patch, or ring. You need to get your thyroid check or look for premature menopause or other causes.
How do you know if you're not just a sweaty-ish, like...
Yeah. So hot flashes usually come on for no reason. So if you were giving a talk like I am, I always get sweaty under the armpits, but that's because I'm a little nervous, right? But like you're just sitting there is what hot flashes happens. And then you get crazy hot and you just start sweating. Or a lot of women have night sweats. They'll wake up in the morning and they're just sweaty all over their sheets and stuff. And that never happened before. And that might also be a sign of other stuff, cancer, tuberculosis, infection, not related to birth control, not a common thing. I have said that, being on birth control is kind of a chemical castration. But what I mean by that is that I no longer have to cycle up and down every month, but it didn't kill the hormones. When you kill the hormones with GnRH or with menopause, then you get the hot flashes that are traditional hot flashes.
Okay. Thank you for letting me know. Recently, I've just been feeling hot when I slept, but I also think it might be the weather. If you guys are in California, Bay Area, it's been 100 degrees. So, and I'm not usually typically that sweaty. So I'm like, oh, I probably not hot flashes, but that was what I was thinking lately.
You should check the temp. I'm very temperature sensitive, so I put a little thermometer thingy in my room, and I've learned anytime it hits 76 degrees, I am not happy.
76 isn't even that bad.
I know.
That's too hot for you.
I was born in the dead of winter in Chicago. I blame it on that.
Oh,
I like cold.
Ooh, you like bundling up.
Yes.
I see. Okay. Next question is, does birth control make you tired? So I know a lot of my friends, they're like, oh, every time I take birth control, I just feel so lethargic. So is that your birth control, or is that just you? Where does that come from?
Yeah, I think it's not a common side effect. So, when they do drug studies, they list the top 15 to 20 side effects, and tired is not one of them. If you're feeling tired, I feel particularly with COVID, I think we're all just in this like depressive funk of not knowing what's going to happen. And for those of us in California, just looking outside, I'm like, we're going to need some anti-depression sunlight, lamps, because this is like living in a dystopia or something like that. I think the most common reason for feeling tired is people aren't getting enough sleep, or you're getting poor sleep. So the not enough sleep is too stressed, too busy, don't have time to sleep, too many things to do. The poor sleep is with technology. We're in front of our computer, our phone, right before you go to bed. We really recommend a half an hour or an hour of no light, blue light screen time before you go to bed. And ideally, you should get 6 to 8 hours of sleep every night. And if you're a teenager, 10 hours of sleep. Wow. But as an adult, I'd say 8 hours. I personally love 10 hours, not that I ever get it, but 8 hours. And if I get 6 or 5, then I'm just kind of tired. The other thing is, if you take the pill and you feel tired, I think it's because you feel it's a burden, right? Why the hell do I have to do this? Why doesn't the dude have to do this? And it really sucks for those of us that have uteruses. We're the one that gets pregnant. They just walk away. And it makes like, oh, I'm gonna take this stupid pill. How come he doesn't have to do anything? And it just, so the way I did it with my significant other is there was 3 weeks of active pills and 1 week of placebo. So I would make him take the week of placebo. I'm like, you 1 week out of 4, suck it up. Though he doesn't have any risk or concern for breakthrough bleeding or pregnancy. And then now we just recommend skip that week of sugar pill, but you can still make your significant other take pills for a bit, just for fun, or that's just
a challenge. We should do like some challenge. Everyone get their like significant other who's not on birth control to try to take birth control at the
just
same
take
time.
a vitamin at the same time every day and see who messes up first, the vitamin or the birth control pill. Right? And then whoever loses has to like massage the other one or buy them something that we want.
I like that. Okay, so our last question today is, what happens when you take birth control and amoxicillin? So I believe amoxicillin is an antibiotic, right?
Exactly.
So, yes, if you guys didn't know, I did take biology in college. I still remember some stuff from microbiome, but I'm guessing some people are taking it and they want to know if there's any interaction there. Will it make their birth control less effective? What goes on when you take it at the same time?
Yes. So if you were to look at the science and the research and the papers that have been done out there, there's only 2 antibiotics that have been shown to affect birth control pill, patch, or ring and the hormones that are in there. And one is rifampin, which is mainly used to treat tuberculosis. So if you don't have a diagnosis of tuberculosis and someone didn't write you a prescription of rifampin, don't have to worry. The second medicine is Griseofulvin. And Griseofulvin is used for toenail fungus and fungus of the hair. And that actually only happens in African Americans, that particular fungus. So if you don't have fungus of the hair or fungus of the toes and were prescribed the word specifically Griseofulvin or the name brand of it, look at the generic name is Griseofulvin, then your risk of the antibiotic affecting your birth control pill, patch, or ring is very low according to the research. And in fact, if you Google antibiotics, Pandia held birth control pill, we have a list of 9 antibiotics that people want to blame on messing with your birth control pill, but the research has said specifically it does not. So ampicillin, ciprofloxacin, clarithromycin, doxy, metronidazole, ofloxacin, rosithromycin, temafloxacin, and tetracycline do not affect your birth control. However, I always like to say every person is different, every uterus is different, and there has been some speak of your enterohepatic recirculation of your birth control hormones. And so you can imagine if you take antibiotics, it'll kill the bacteria in your stomach, in your intestine, and then you don't have this enterohepatic recirculation of your hormones, and so that might decrease the efficacy of your birth control. So if you're going to be on antibiotics for a week or two, wouldn't hurt to back it up with some condoms or just refrain from sex during that time, whichever is easier for you to accomplish. But my joke is I've never seen a guy not get off with a condom. So just, use a condom to be safe, because better safe than sorry. We don't want anybody getting pregnant that doesn't want to be pregnant. And using a condom for 2 weeks or a week won't kill you. And if you find the right condom, that's my other tip, is that there are different thicknesses of condom, and you want the thinnest one possible without increased breakage. If you go to condomdepot.com, and we don't get paid for them, but I just love them. They have he said, she said, like the one with the penis graded it at A-, and the one with the uterus graded it a B+. And so in my teen clinic at Stanford, I pride ourselves on picking the ones with the highest rating, so that way you'll feel better and more likely to use it. And in general, I just say use a condom every time, whether or not you're married or not. I carry a condom bag, and the people snicker like, she uses condoms. Is she cheating on her husband or vice versa? And it's like, actually, I think we women don't talk about it, but if you don't use a condom, they squirt sperm, and then you're leaking sperm for 24 hours. That's disgusting. And the sperm actually mess up the natural flora of your vagina. And if a dude or whoever, the one with the penis, had to leak your secretions for 24 hours, they would sure as hell make sure you put on a condom.
And I think that's a great segue into actually the month of September is Sexual Health Month. And so we are releasing a lot of sexual health, also PCOS Awareness Month, back to school, a lot of things, but Sexual Health Month is this month. And so we will be doing more content related to sexual health, sex positivity, even though we are like a birth control company, and we want people to be enjoying having sex and make sure that they're safe and, not worried, one, about their birth control, like the pill anxiety that Dr. Yen always talks about, but also making sure that, when you're having sex, it's fun, you're protected from any STDs, unplanned pregnancies. Like the last thing you want is to be doing something fun and intimate, and then in the back of your mind, like, oh my God, something's bad's happening, or something bad is going to happen. And so
sex is better with birth control. Sex is better if you're not taking a risk of getting a sexually transmitted infection. And I really think that for those with penises out there, if you have a uterus partner, that the uterus partner will be far more into sex if they don't have to worry about pregnancy or sexually transmitted infections, because in a heterosexual encounter, the one with the uterus has a greater likelihood of catching a sexually transmitted infection, because we are the repository versus this is just dip in and out, whereas we are left with stuff.
Yes. And I think later on we could also talk about, we've gotten questions about, oh, well, I don't need birth control because I'm not in a heterosexual relationship. But for Sexual Health Month, we will discuss, okay, well, what are the other great things about birth control that you can use? For example, acne, or, PCOS, or like people with endometriosis, or even just skipping your periods. And so all of that can be discussed, and we'll be posting more content throughout this month. So I hope everyone enjoys. Before we end this, I also want to remind everyone to, one, get your birth control if you already have a prescription with Pandia Health. We are the only women-founded, doctor-led company. We do care about you and your health. And I know that we always want to promote our expert doctors like Dr. Yen, Dr. Niem just visited us. If you want to check out our amazing doctors who write the prescriptions for you, they're on our website. So visit us at pandiahealth.com. And if you need that new prescription, we are again in Arizona, California, Florida, Texas, and Wyoming. And if you guys do have any questions, feel free to DM us. Our patient care advisors are always there on the bottom right of our pandiahealth.com website. And also really cool news is that we just upgraded kind of our health form online, and it looks really beautiful. Our team put a lot of hard work and, only to make the experience for you guys really easy. So make sure you sign up today. And thank you so much, Dr. Yen, for joining us this Wednesday.
Thank you so much for having me. Angela is the head of our marketing. She's amazing and just an advocate. And so glad that we have an amazing team at Pandia Health.
Yes. Shout out to the team, everyone there. Okay. Thank you, Dr. Yen. And I hope everyone has a great Wednesday.
Great Wednesday.
Bye.